And I think we should probably begin. So welcome everybody to World Health Week on this first day of World Health Week. My name is Sam Myers. I'm the director of the Planetary Health Alliance, and we have a really wonderful webinar today to discuss the sort of extraordinary proliferation of new initiatives over the last 6 to 12 months around the world focused on planetary health, and in particular to showcase some of the work being done by the World Health Organization and by organizations in Germany, as well as the SAO Paulo Declaration on Planetary Health. So I'm going to introduce our moderator. This webinar is being sponsored by the Planetary Health Alliance and the World Federation of Public Health Associations in collaboration with the World Health Organization and with WBGU in Germany. And our moderator for this session is Dr. Nicole de Paula. Nicole is a senior SDGs expert for the Food and Agricultural Organization of the United Nations, as well as the founder and executive director of the Women Leaders for Planetary Health, which has been a really important sort of new entity across the field of planetary health globally. In 2019, she became the first awardee of the Klaus Topfer Sustainability Fellow at the Institute for Advanced Sustainability Studies in Potsdam, Germany. She holds a PhD in International Relations from Sciences Po Paris and is the author of the recently published book, Breaking the Silos for Planetary Health, a Roadmap for a Resilient Post-Pandemic World. So with no further ado, I'm going to introduce Nicole to take it away. Greetings, Nicole.
Hello, everybody, and thank you for joining us. Thank you, Sam, and the Planetary Health Alliance for inviting me to be part of this event today. It's always like kind of coming home. It's a nice feeling to be all of you. But unfortunately, we are living also in a very delicate moment, right? So which can make the idea of planetary health sound a bit utopian. But however, in times of this multiple challenge, and I'm of course here specifically thinking about the humanitarian, the energetic, and the food crisis, our conversation today could not be more relevant. Planetary health is truly about preparing for the future, but also collecting multiple benefits already today in the present. So as Sam was explaining, we are following the 10th Global Conference on Health Promotion, which was in December 2021. The Geneva Charter for Wellbeing was agreed to express the urgent need to create a sustainable wellbeing societies. They are committed to achieve equitable health, but without breaching these ecological limits. And also on a similar path, after the 4th Planetary Health Annual Meeting happened in April 2021, which was hosted by Brazil and the University of Sao Paulo, we developed the SAO Paulo Declaration on Planetary Health. And this was a first effort to mobilize these multiple sectors to engage planetary health and bring these conversations to decision makers. So important to really bridge this implementation gap that we usually see. So our goal today is to introduce the planetary health and share why this approach is so needed to accomplish the well-being agenda. So let me present our distinguished guest today. I'm very pleased to have with you from the WHO, we have Dr. Rüdiger Kretsch, who will introduce the well-being agenda by discussing the Geneva Charter. And Dr. Rüdiger is the director of the Department of Health Promotion at the World Health Organization, where he leads the WHO's work on risk factors such as tobacco consumption and harmful use of alcohol, on health promoting settings and programs for more physical activity, and on supporting member states in public health legislation. He was awarded a doctorate in public health at the University of Bielefeld and was one of the first public health graduates of a German university in 1991. So welcome, and Rüdiger. I'm going to also present our next two speakers because to discuss planetary health framework, and focusing on the SAO Paulo Declaration, we have Dr. Carlos Perron, who is the Associate Director of the Planetary Health Alliance. He is the co-founder and current director of the Inter-American Center for Global Health, which is the first global health hub in Central America that seeks to redefine the meaning of leadership in global health through innovative educational approaches. Dr. Verhoeven is also an assistant professor and director of global health programs at the University of Maryland in Baltimore Graduate School, and he obtained his medical degree at the University of Costa Rica and his master's in international health at the Queen Mary University and the Free University in Amsterdam. Finally, we'll have Dr. Sabine Gabrisch, who will share about the planetary health in practice, how this is evolving more specifically in Germany. So Dr. Gabrisch is the department head on climate resilience at the Potsdam Institute for Climate Impact Research, as well as professor for climate change and health at the Charité University in Berlin. Dr. Gabrisch is currently a member of the Advisory Council One Health of the German Federal Ministry of Economic Cooperation and Development and of the German Advisory Council of Global Change, what we call the WBGU. She studied medicine in Tübingen and Providence, Rhode Island, and also epidemiology at the London School of Hygiene, Tropical Medicine. So, and this is just the short bios of our speakers, right? So we had to reduce, and it takes a long time to share all this amazing background. So I'm truly honored to moderate the discussion and kick off the dialogue. Let's start with you, Dr. Rüdiger, who is really tell us the whole panel here, how do we use the planetary health approach for our well-being agenda? And so with that, welcome, Rüdiger.
Thank you so much, Nicole. And dear colleagues, a happy World Health Week. And we are going to have the World Health Day on the 7th of April, as you know. Also on this topic, by the way, on our planet, our health. At WHO, we're very concerned because health promotion is actually to enable people to take control over and to improve their health. This control over people's health and lives, by the way, is absolutely compromised by the current crisis that we see. It's not just the pandemic, it's the environmental crisis, it's the social crisis, it's the hate, the misinformation, the fake news in the internet, war now. So we are actually hopping from one crisis to the next, and that compromises our ability to take control over our health and lives. People, if I may say, they have had it. We all are tired. And the question is now, how do we gain back control over our health, and how can societies, and must societies, help us to enable us to do this? Now, that was the theme of the 10th Global Health Promotion Conference, because in this urgency, we also see that if we're now not acting on this, on the main risks that societies face for future pandemics, for a technological crisis. So what are those fundamental risks? And if they are not now being addressed, we will face a next pandemic in our lifetimes. We are sure about that. So therefore, we need to urgently now put in place mitigation measures to actually counteract those risks. In the Geneva Charter for Wellbeing, we have outlined what the main 5 action areas are. The first thing is that we need to build well-being economies that work within the boundaries of the planet. At the moment, we see that GDP measures are not enough to measure overall development and whether or not we are counteracting those major risks. Therefore, economies in the future must much better and in a very comprehensive way address those risks that we have identified, about 30 of them, that can lead to a next pandemic. For instance, uncontrolled urbanization, in which we are moving more and more into wildlife, increases the risk of zoonotic diseases. Or the way we're looking at waste management, at the way we are looking at food and safety of food, and many more are those risks that we need to address in our economies. Then the next thing is to look at the risk factors for NCDs, where we know that if we're not addressing them now, we will crack all health systems. They cannot sustainably be financed. So therefore, we need to work on those at the same time. And we need to address the technological transformation. This means that we see an ever-increasing pace of innovation and cycles of total revolution, IT revolution, which has taken in the 1990s about 20 years, which takes about 5 years today, and which will only take 3 years in the next 10 years. So also here to see what is enabled to take or what enables us to take control over our health, where we see that technological advances change our lives. A webinar like this would have not been possible 2 years ago. It has changed our lives of many of us in the last 2 years. What will come, and will it be for the better, for the improvement of our health or not, remains to be seen. That's why health and public health need to be at the front line to identify what the benefits could be, but at the same time, what the risks are. So there's many things, many new things that public health needs to take on. For instance, on the economy, many other organizations are working on this, and that's the good news as well. We know, the world knows what to do and how to do it. And we believe that adding the health component now to understand what the potential health risks are, and to get together the different sectors and research communities in order to address those risks for health is now what needs to be done. So therefore, this is about what you will find in the Geneva Charter, and I'm happy to discuss this with you in the next hour. Thank you very much, Nicole, back over to you.
Thank you. This is fantastic, because also knowing we cannot move on from crisis to crisis, but we know what to do. And that's an important message here, that we just need to really implement this knowledge. So let me just, we have many questions already, but let's do a first round, and perhaps moving now to Dr. Carlos Verón to share a little bit more of this approach of planetary health in the context of the SAO Paulo Declaration. Carlos.
Thanks, Dr. DePaul, and thanks, Dr. Craig, for those comments. I'm going to share my screen, but these are just visual aids. I don't expect you to soak them all in. If you want to pay more attention to what I'm saying, I think that'll be better. I'm just going to put this in smaller mode. So I also want to thank the World Federation of Public Health Association for the invitation to participate in this panel. And I think I want to start with something that really can't be stated enough, which is where the kind of the narrative of planetary health starts, which is in the sheer scale, right, of human impacts on Earth's natural systems has really increased exponentially to the point where this impact now exceeds the planet's capacity to provide the resources both we and future societies will need will need to thrive. And the result of these actions is a vast and very quickly accelerating transformation and degradation of nature. And of course, this transformation does not only include global climate change, but also includes the pollution of the air, the pollution of water, the pollution of our soils. It refers to the degradation of our forests, our rivers, our coastlines, our oceans, and not to mention the unprecedented rate at which we are losing vital biodiversity. And those are some of the core insights of planetary health, and where we like to build that arc of narrative as a field and as a movement. But for those that might not be completely aware of the term, or that might be new to the term, I want to express that these disruptions and degradations to our natural systems, these really unprecedented anthropogenic changes of natural systems, are actually a clear and urgent threat, not only to what we call the web of life, but also for societies as general. So planetary health really it highlights the need for there to be a balance between healthy communities and the stewardship as well of our natural ecosystems. As an interdisciplinary field that we are, and also as a multi-sectoral movement, we emphasize that the scale of the effects over these natural systems is really, really affecting our health now, be it in form of a nutritional disease, our exposure to infectious disease, our risk of developing non-communicable disease, and even our mental health. And we have to be able to elucidate the ongoing and future threats to that of our well-being. Much of it still remains understood. And finally, this narrative that we built in Planetary Health says that if we decide to continue this status quo trajectory, and this is why documents like the SAO Paulo Declaration, of which I'll speak to in a second, and the Geneva Charter for Wellbeing become so important, is that if we do not change our trajectory soon, natural systems will no longer be able to safeguard human health and well-being. And that is an alarm that the narrative of planetary health have so eloquently been able to crystallize. But I don't want to only focus on the gloom of the narrative. I want to focus also on how we move forward, which I'd like to put just a little plug on the Planetary Health Alliance, which is the organization that I'm here representing today. So we launched in 2016. We were preceded by the Rockefeller Foundation Lancet Commission report on planetary health in 2015. And we're currently a global consortium of around 270 institutional members from nearly 60 countries. We are based at Boston, the Harvard T.H. Chan School of Public Health. And our members come from a wide array of sectors, including academic institutions, non-governmental organizations, multilateral organizations, government entities, and as well as the philanthropic and private sector. And we're inviting all people in this webinar and beyond, anyone who might listen to this deferred, that we also launched individual membership. So now as an individual, you're welcome to join. And we hope both individuals and organizations join our movement. Now, what do we do in planetary health, both as a movement and as a science? And what we do also as an alliance can be summarized in this lens. And I want to borrow here from the initiative People Planet Health, which I also invite you to visit their website, as they are both the People Planet Health initiative is interlinking the planetary health community with the well-being agenda. First, we take these overwhelming, these daunting, very complex threats to our health and the environment. We take those and we try to make them understandable. Both scientists, communicators, and community members themselves all around the world, with making these very complex issues understandable, are enabling people to make sense of the large-scale challenges and have them contextualized in terms of how they impact their own life and that of their future generations and the places that they live in. Secondly, in the face of these enormous challenges, we try to create meaning and hope for people by giving our network and the communities they serve the necessary frameworks and the contextualization to generate a sense of importance and value, motivating people to care and prioritize planetary health. And thirdly, we want to empower people to take convergent actions to solve the challenges that we are facing, against which people will feel powerless. We do this by creating innovative actions in which people can build networks and create solutions that build on each other. And because I know we're here with some audience members that might be new to the planetary health community and are representing more the health promotion community, I'd like to offer again 3 things that built on the Geneva Charter in which planetary health and health promotion intersect, and why we should not actually delay. This is a kind of a celebration of our joining of our movements, why we should not delay the merging of the movements. Number 1, right? Both the planetary health movement and the health promotion movement recognize that the intersecting and interconnected nature of the determinants of health, including a healthy environment. And beyond these, both frameworks seek to foster a compassion for planet Earth through the recognition both of the personal, the social, and the emotional aspects that we can find in the concept of well-being. Second, we both see health equity as a core driving value of the work we do. equity and justice in planetary health and also in health promotion are founded on the rights and dignities of humans, but also in the rights of nature. And we want to give humans and populations and ecosystems, present and future, the opportunity to attain full vitality. It is in both movements that we recognize the importance of understanding in structural inequities, realizing that equity and justice requires eliminating systemic disparities so that no population, now or in the future, will carry disproportionate burden of environmental and health impacts, while a few are allowed to thrive. And third, we are sharply action-oriented. We focus on population empowerment, agency, dignity, movement building, and systems change. There is no doubt today that grassroots, bottom-up, community-led movements are already moving the needle. And effective movement building will be one of the keys to solve our urgent planetary health crises. Now, before I wrap up, because I'm running out of time, I want to put a plug in here for the SAO Paulo Declaration. Now, as Dr. De Paula was mentioning, the SAO Paulo Declaration, just as the Geneva Charter, is an urgent call for societies in plural to make transformational shifts now on how we live in order to optimize the health and well-being of all people and the planet we depend on. The declaration was born out of an imperative for this urgent action and was published in the Lancet in early October in 2021. The central tenet is its concrete action-oriented recommendations for stakeholders all across the board that will enable and support a more just and regenerative post-pandemic world. I invite you all to visit our website, planetaryhealthalliance.org, and read more about the declaration that recognizes this symbiotic relationship between sustainability and the people that live in it, and where we invite groups and organizations and individuals to find novel ways to think about and how to attempt and achieve planetary health. So again, just as an invitation to join the movement, visit our website, read about the Planetary Health Alliance's work, as well as the SAO Paulo Declaration. And I hope to have enriching conversations in the after period of this first round of comments.
Thanks, Carlos, so much. And of course, I would also support this invitation to see the SAO Paulo Declaration. Being from São Paulo myself, it was a very pleasant thing to see this movement, this large consultation, because as you mentioned, the Planetary Health Alliance and all this movement, it's about action-oriented, and this will not happen without the people and people empowerment. So that's a very important message here. Thank you so much, Carlos. And so let's move and continue with Dr. Sabine Gavrisch, who is speaking from Germany today, and probably also happy to share some specific at your personal journey and how Germany is receiving all this conversation about planetary health and well-being. Thank you, Sabine, and welcome.
Thank you, Nicole. Well, in fact, there would be so much more to say about Germany. I'll try to say a bit about this, but earlier you asked me to focus on WBGU, so I'll say a little bit more about that. So the English name is German Advisory Council on Global Change, and it was set up in 1992. So yes, a round birthday is this year. That was in the wake of the Rio conference, and as an independent scientific advisory body to the German government, to focus on global environment and development issues. And so it's not about Germany nationally, which is covered by other advisory bodies, but it's about Germany as an international player regarding global environmental changes and sustainable development. And the WBGU is highly interdisciplinary. It consists of 9 professors from totally different disciplines who are appointed for a 4-year period each. And there are research analysts and a secretariat. And all these people jointly write 2 flagship reports over usually 4 years and some shorter ones. And jointly really means jointly, which can be quite an adventure. And from the time frame, you see that this is not on daily politics, but it's rather with a long-term view. So we don't do original research, but evaluate existing research, point out new problem areas like some kind of early warning system and research gaps, and appraise global sustainability policy and give recommendations for action and research. So the ministries can express areas of interest and there are regular discussions with them, but we pick our topics ourselves and we're totally independent in what we write. And in the past, the ministries did not always like or appreciate what the WBGU wrote. So the purpose behind this is political decisions often have to be taken in uncertainty in the face of complex problems. And these scientific advisory bodies, scientific policy advice can give orientation by providing an overview, explaining causes and effects, and assessing risks, especially those that cause irreversible damage, and pointing out promising options for action to provide guidance for decisions. So these reports are, on the one hand, directed to the policymakers, but they're also directed to the public. The fundamental systemic changes that are needed also include some mind shifts of the population. And as you already mentioned, a lot of mobilization from different actors in society to eventually end up in policies. And actually, a lot of that has happened in Germany over the last few years, from the medical community, the German Alliance for Climate Change and Health, and the Health for Future Action platform that went from it. There was this Planetary Health Academy that really mobilized action. There are groups in many cities now, medical societies, the German Medical Board has come along, and so on. So there's quite a lot of transformative change momentum. Now, actually, I have a few slides. Blah, blah, blah. Did I see this still? Yep, sorry. So the WBGU helped establish some new concepts, also like planetary guardrails, the 2 degrees limit, Earth system tipping points, and the CO2 budget. And the reports were often visionary and ahead of their time. So, for example, the report on the Great Transformation was published in 2011, and only now has the transformation arrived in German politics and indeed elsewhere as well. Now, for the first time, the WBGU is now working on the interconnections between health and global environmental change. And we have recently published this short discussion paper to get input to our next flagship report, which is on planetary health that we want to get out next year. And the idea there is to think about the common root causes of global environmental and health problems, because then we can have common solutions if we tackle these root causes. And it's about a positive change story away from the destruction and exploitation and towards a better quality of life and acting together for that, and connecting the health perspective with the sustainability and justice perspectives. So hoping that the concept of planetary health, this realization of how deeply our own well-being is connected with nature, with animals, and with other humans all around the world, how incredibly vulnerable we are as an individual, but also each one of us, but also as a society, but also how amazingly powerful we can be together, and that this could provide the much needed boost for the transformation. That health can be sort of a game changer and give it a more exponential dynamic, like a viral spread of social change. And then, of course, we want to spell out what solutions could look like in the different areas with all these win-win opportunities in food, mobility, and so on. And what this requires from policies and education and science to enable the transformation. Yep, that was the few slides. And yeah, more or less what I wanted to throw in. Thank you.
Thank you, Sabine. I hope it's a good virus, and this virus, the health, it has to be a positive one, right? We need to, hopefully, because they evolve quite fast. So I like what you said about the root causes of the problem. It's really, I think, trying to not move from crisis to crisis, and then using our resources not in a smart way. We're seeing how national budgets are changing so quickly. Well, Germany is a very emblematic case of how perceptions change overnight. So this is a very important topic. So we do have time now, and to the most probably the very exciting part, because we can have a little bit of a conversation here. And we received so many questions already, so I'll try to select a few here, and maybe I can start with Dr. Rüdiger here. We have a question for you. And the first one might be, how did the health promotion unit at the WHO come to the conclusion that the WHO cannot effectively promote human health without destabilizing our planet's natural systems? It's a little bit of the changing in perception, right? The mindset is so important probably in our conversation. So happy to hear your thoughts on this one.
Yeah, thank you so much. Well, indeed, I mean, let's look in, at the current crisis, the COVID crisis. At the moment, you have a lot of, let me give you the example of vaccine hesitancy. Vaccine hesitancy is definitely a reason because people have lower rates of health literacy. And so we were not able so far as a health promotion community, obviously, to convey a comprehensive structure on how you actually increase.
Sorry, Rutger. I'm sorry to interrupt, but I think we're hearing a strange sound from your microphone. And we do get the ideas, but it's not so clear. So I'm not sure if we can move something there, but maybe especially for the recording, I'm sure people would be very interested to be following us later. And is there anything that we can change, or maybe we can, if I give you a few minutes?
Yeah, try.
Yeah.
And
it's working now. It's working now. I think when you lean forward.
Is it working now? Can you hear me now?
What's the magic?
Sorry, I
share also that trick.
Exactly, I don't know. So, colleagues, let me give you the example of the current COVID crisis, and in which we see a lot of vaccine hesitancy. And that hesitancy definitely is also due in parts because of low health literacy levels. So we need to see how, for instance, we can assist colleagues who are working on the preparedness levels of societies, but also then in the response, how we can actually be there with the people to understand their worries, their concerns, how we actually can help with information. But we see that health information alone doesn't make the trick, but how you can include specific information into your everyday life. And that, had we been there at the forefront of this pandemic, I think would have helped to a lot in looking at how the vaccines could be introduced, under what sort of circumstances, and how they could be applied. I can give you the example of now looking at urbanization as such. We see that we have been very much in the limelight on specific healthy cities programs. But still, you see that, if I may just say, profits by themselves in, for instance, enlarging urban settlements without having clear plans how they can be done with respect to the planet and the potential risks. So to understand community participation and to engage people into urban planning would have helped a lot in mitigating that risks of urbanization. So that's why we believe that we need to offer our services, our over 40 years of experiences for the challenges that we're facing today. And this includes then the economic model that we have. And so again, by looking at specific values of human well-being that drives economic development, would have helped, if I may take the current crisis that we're facing in Ukraine, to think 3 times before you make yourself dependent on one source. And it's not whether it's Russia or somebody else, but it is the diversification of risks so that you're minimizing the risks that you're facing overall. So that is what is at stake here, and where we from health promotion try to actually help now the the different societal aspects that we're seeing, the crises that we're seeing, to overcome them. And I could just also add, with regard to the digital transformation, that the information that you get from the internet is not evidence proven. So who tells us whether the information that you're Googling today is actually beneficial and helpful for your choices that you're making on your behavior? And how can we help from the health promotion movement and the public health movement to actually build up a sort of cascade model of evidence where I am sure that the information I get is true, first of all. And then secondly, what different sources of evidence have shown whether there's something that is, for instance, effective or not, right? So there's much, much more that we need to put out there, that we know how to do this, but we're currently not there to actually implement that. And that's why we have put out this Geneva Charter for Well-being, because we believe that we have a lot to offer from the public health side.
Thank you so much for that. And you're completely right? This information alone doesn't do the trick. And this infodemia we have been experiencing together with the pandemic is such an important aspect of any solution that we are trying to build. So thank you to our guests for sending questions. And I do have another one here. And maybe I'll pose to both of you, Sabine and Carlos. And then I will couple with why do you think there has been such an extraordinary proliferation of these new initiatives, organizations, and national efforts focused on planetary health in the past year or so? Why now? I think there are some elements of the discussion that suggest that. But maybe if I may add, what in this context that we see this the big expansion of planetary health knowledge also, what makes you personally interested in the field that you all had, of course, a large background in public health, and now you have this passion also in proliferating planetary health for well-being. So who would like to start? Maybe Carlos, Sabina, maybe Carlos?
Great, thanks, I appreciate it. And it's a great question on why we've seen this proliferation. I think we have to start by saying, one, the science every day is more clear. I think as most of us come from this scientific background, we've been able to crystallize that knowledge much better. Second is we're learning to communicate, right? It's a process to communicate that better. As scientists, it's part of what we do. I think all organizations that are represented here in this panel are working towards that, be it mainstreaming the communication to public audiences, mainstreaming the communication to higher officials, decision makers, or governments themselves. I'm talking about what Sabine and what Rudiger does, right? So not just the science, the communication, but also because the crises are becoming ever more evident. We are now part of, it's not something that we're going to feel in the future, right? We keep hearing this, but we're living through these crises right now. So it's becoming more evident. And that evident, that let's say that living through the crisis really creates this contrast in which instead of seeing it as a slow moving change, we're seeing rapid changes that creates these black and white transitions that help us feel and look at that much more easily. So that's one of the reasons I think, or several of the reasons that I gather this really has taken off. People are personally feeling this more and more. I'll stop there and then I'll go to the second part of the question just in case Dr. Gabrish wants to add.
Okay, so we'll go back and I will remember because I think this personal touch is also very interesting for our guests. So Sabine, in your view, why do you see this explosion of planetary health interest?
Okay, well, to add, like some of the points Carlos already pointed out, and I think it's that the crisis is becoming more serious. We're now in the middle of climate crisis, biodiversity crisis, and so on. And we have heat waves have been not seen before, and floods, and we see that insects are disappearing, and so on and so forth. So I think actually that people notice it in their own, and also richer people notice it, more privileged people, that we're feeling like in Germany, you think, oh, we are on sort of like an island, we won't be affected, it's only the poor get affected. And now they realize, no, it's us as well, we're also part of this planet. And then I think another source of why this is taking off is also, I think the Fridays for Future movement has really changed the discourse of how we speak about things, and this has brought in a lot of momentum into the debate that could then be connected with the health people becoming aware of the issue and so on. And yeah, and maybe to link over to your question, why do I care about this? Well, obviously I care about the well-being of other humans and all other living beings on this amazingly beautiful planet that we are a part of. And it's so important to look at the whole system. So it's not just climate change, it's also biodiversity loss, it's pollution, and it's social justice. And it's a bit like a good doctor, you don't just treat the fever and forget about the liver and the immune system and so on. So Planetary Health has this systems view, from organisms to ecosystems to the earth even as a whole. And another thing is, I think it has a huge potential for inspiration, for imagining the world differently. And I believe that realizing our deep connectedness with all life can really start the process of healing our relationship to nature. Like this UNEP report said, stop our suicidal war with nature. It's true, like we need a different relationship, and we need to all get active together and create this better future. It's not coming by itself. And I have the feeling that a lot of people really get it, and they're not happy with all this consumerism around them, also the younger people, and they realize there are deeper values, there are more important things to fight for, and this Planetary Health has a lot of these things in it, the health aspect, the environment and nature aspect, and also the justice aspect. So that's why I think it's quite a culminating point for many different people and movements and so on, and it has this transformative aspect. I think that's the important thing. Is that we're not just doing some incremental little changes on things. We really need to see what's flawed, what are the fundamental flaws, and how can we go about them, and also face the corporate interests that are behind that. I think that's also one thing we can learn from health promotion. I've been fighting with tobacco and big alcohol and so on, and now we have big oil and big food and big pharma, and all these, they're not necessarily acting for the best of next generations, yeah, and the poor.
Very important. It is not incremental, but transformative transformations that we are thinking of seeking here. Very important point in the corporate interest as well. The health sector, very well placed to have this. And Carlos, I think you want to complement from your perspective. And
just quickly, I think my personal story really intersects and highlights the importance of the narrative. I'm a Costa Rican, and Costa Ricans really built, it might be a superficial narrative, but it's a narrative that we really get embedded with us, that we are part, we love nature, we protect nature, and nature is part of our well-being. If anyone knows anything, if there's something to know about Costa Rica, is about its nature. And I think biodiversity protection, the creation of the national park systems, and how we understand ourselves as a society, quote unquote, peaceful, nature-loving society, really, from my youth, really built a relationship with nature that then, as a health professional, I was easily able to put together. And this is why I'm now intersecting in this world. Now, obviously, those narratives need to be strengthened. They need to not be superficial, and they need to be based on values, which, again, I saw some commentary in the chat that this should be embedded since kindergarten. And yes, I agree, but it also should be embedded in the family. It should be embedded at community levels. It should be embedded in policy, not just health in all policy, but in all forms of decisions that we make. So values will drive that change, will drive the changing of our stories, our societies, our policies, and our actions. So for me, that's where this more personal aspect comes from.
Thank you, Carlos. Values absolutely important. And you mentioned during your talk the issues of justice, and part of this, what we're trying to achieve here. And so maybe linking to this conversation too, we have a question here for all the panelists, but I think Dr. Rüdiger can help us. Somebody's asking, what role can scientists and clinicians without strong backgrounds in epidemiology or planetary health play in promoting planetary health and this well-being agenda?
Yeah.
Maybe a little bit of what other people can do. I think there is a role for everybody. That's one important point in our conversation.
Yeah, first of all, it's about true facts. Secondly, it's about communication. So how do we communicate sometimes very complex research findings into ways that we can all relate to? So, and that's a part of the intersectoral collaboration. It's not to be generic, but it is the art of actually transforming complex issues into a language that can be more easily understood. And this is then helping people to make the links between the different sectors, the different areas of science, and to understand the potential impacts on our health and lives. And that is where I think that epidemiologists, but also scientists from diverse different sectors can actually come together to, number one, to understand what the impacts of this is on people's lives and health, and then together to transform the language we're using in science, which is often very difficult to understand, into one that makes sense for all.
Thank you so much for enriching us, and thank you the audience for saying so many relevant questions. And I think one point, the $1 million question is somebody's also asking, how do we best systematically provide political leaders and health ministers with the value proposition? For example, we talk so much about cost effectiveness, right? That's what I say. We want to talk to politicians and decision makers. We need to talk about cost effectiveness of divesting from fossil fuels and instead focus on country-specific mitigation and adaptation plans. And then how we go and really shape this planetary health beyond the fossil fuels issue, right? So I just want to make it before maybe the panel can discuss, and I see, Rüdiger, if you're excited also to take this one, but I have one specific point because I am working also now at the Food and Agriculture Organization, and we know that today's food systems generate 12 trillion in hidden social, economic, and environmental costs. So we do need to, but there are so many opportunities if we transform our food systems to unlock so many benefits that we will, of course, connect to planetary health. And the current crisis now really shows us that that's the time. So I would maybe, we can tackle this question that Rüdiger, and maybe I put another one for the panel, maybe Sabine, if you would like to tackle this one, how this multifaceted crisis now on the humanitarian, food, energy can delay or accelerate this mainstreaming of planetary health. What's your take on that one? So maybe I'll start with Dr. Rüdiger.
Yeah, thank you. The question on how can we make this value proposition so that it's actually taken up? That I think is the question. Now, very often it is not the return on investment. It's not the evidence that drives policymaking. We need to understand that, I believe. It is interests, commercial interests. It is corruption. It is many things that are elephants in the room that we in public health, at least, have not yet tackled so much. But in health promotion, we are working on those commercial determinants of health. What drives industry? And of course, there it's tough markets. In health, for instance, health is the biggest economic driver in the world. So there's lots of interests attached to it. So how do we understand the different interests of shareholder and turn it into stakeholder value? So how do we get from a shareholder to a stakeholder value? And that is how to get those interests that would be in favor of a more healthy choice together to counterbalance the lobbying mechanisms that the other industries are doing. We need to understand that there's thousands of people in every country that make their money to lobby for certain interests. Now we need to understand that game, and we need to pool those interests which are on the healthy side in order to counterbalance the lobbying from the other. And that is something that I believe in when we're looking at governance issues, it's especially participation, empowerment, and community engagement. We need to better understand that sort of agendas. And I think then we can be successful. We see this now currently, Sabine, you're from Germany as I am, and we see that within weeks, we can actually shift the tide of fossil fuels because all of a sudden, not only do we see what it can actually mean in terms of totalitarian governments, but it also shows that there's a very good argument of renewable energy that was put before the government before. So shifting the tide then is easier because we had an alternative. And that is something that we need to better understand. What are the healthy choices that we can put together, pool the interests, move therefore from a shareholder to a stakeholder approach.
Thank you so much. Shareholder to stakeholder, very essential. We do have we have 2 minutes.
Can I just very quickly comment on that? Please. I think the assumption that cost effectiveness is the way to go needs to be challenged, of course, and it's not what I heard from Dr. Craig. Of course, it needs to be an and approach. Of course, it's an and. But challenging the cost effectiveness approach also requires us not just to make a case for the health promotion perspective, but also start measuring the real costs of the environmental impacts that these approaches that are damaging the environment have. So the cost effectiveness will only increase once we start measuring real costs that includes health and environmental. And I think WHO has done a good job at doing that. It has to do with transparency, accountability, participation. It has to do with the way, again, the values that drive society. I don't want to paint a rosy pictures. I know stakeholders are right now shareholders. We need to transform that and put more people around the table that are not only caring about that bottom line in the form of money.
Right. A package of cigarettes needs to cost 23 euros, a can of Coke, $9, and a pizza, $18.
So we need to start putting the true value of things, right? Exactly. So let's use this this moment. There are so many questions. Thank you again to our audience, but I will give 1 minute to all speakers to final words, concluding thoughts, and maybe Sabine, I also would like to hear your views on this moment. This crisis perhaps could be your final conclusion here. That's of how much we need to actually work on this in times in difficult times. So. Over to you.
I think the difficult times will not disappear anymore. We're in the middle of various mixed crises. So this transformation needs to happen in this mess. And every time there's sort of a disruption of the mainstream, and it can be an opportunity, as you said, for now, say the renewables taking over, but it can also be used by people to push back, like we saw now with the Ukraine crisis and the food price spike after the war. And immediately some agro companies said, oh, let's ditch the Green New Deal for farm to fork strategy in the EU. With bad arguments. And then what we did, we wrote a statement that was backed by more than 600 experts that said, no, we need to double forward because our food system is severely dysfunctional, and propping it up a little bit is not going to solve the problem. We really need to have a fundamental overhaul. So I think it depends a little on our narratives and how we get active and engage in this debate. Whether it's going to go backwards or forwards is not a given. But I think there is an opportunity to really argue doubling forward will actually solve so many problems at the same time, because the way we are currently heading is towards an abyss, or against a wall, or whatever you want to say. That it's not towards a good future. So we really need to speed up in the other direction. And yeah, and use all the arguments together. So that was too long.
Thank you, Sabine. Exactly, doubling forward. 30 seconds, Carlos, and then Dr.
Just
Rudick.
building on that, I think we are in the opportunity with the trajectories that we have, where the growth will happen both in population and economies. We know most of that will happen in the tropics. We know most of that will happen in lower middle income countries. So it's now that we have to act. We don't want them to, economies have these trajectories, these inertias, these path dependencies that we can lock in early on. Right now is the moment to do that, especially with lower middle income countries. We need to also shift how high income countries are extracting resources, of course, but it's an opportunity for countries in the tropics today to make decisions that will impact future 10, 15, 20 years down the line.
Thank you so much for bringing also this importance of low and middle income countries being part of the conversation. And finally, Dr. Rudick, 30 seconds on your final thoughts. I know it's hard.
Just to dispel a couple of myths. We always hear there's no money for health promotion. This pandemic costs $9 trillion US, and would have just a fraction of that would have been able to extinguish poverty overall. We always heard, oh, you cannot do this. That's not to get between different concepts. You cannot do this. I have seen a wall fall for, and all of a sudden there was dialogue possible. We have seen in the world that if we want to really address severe problems, we can do this. It's never a question of money. Money will always be there if we have the right values to do that.
Thank you so much. If there is a will, there is a way, right? As we tend to say. So thank you so much for our panelists. I would like to, so the key message is there's no time to lose here. And I think we do have the knowledge to move this conversation forward. Thank you so much to our things. We do have I would like to invite Sam Myers, the director of the Planetary Health Alliance, to conclude this panel. And with that, thank you again for having me. And thank you to our wonderful audience. Sam, over to you.
All right, well, thank you. What a rich conversation, and also a teaser for a conversation we'll be having in just a few days on World Health Day as part of the Planetary Health Colloquium that we've been running over the course of this year. And so we are extraordinarily privileged to get Rudiger to join us once again on Thursday at 1 p.m. Eastern Time, alongside Paul Pullman, who's the former head of Unilever and is very engaged in thinking about the role of the private sector around the Earth crisis, and Michael Weatherhead, who's going to be talking with us about well-being economies. And so we're going to be exploring this arc of if we think that we need to stabilize our planet's natural systems in order to safeguard the health of future generations, how do we embrace these well-being economies, and what's the role of the private sector in really catalyzing the kind of deep, rapid structural changes in how we live on the planet that will be needed? And so we'll be getting into that in more depth. Invite all of you to join us for that. But for now, thank you all so much for joining us for this rich conversation. And thank you, Nicole, for your outstanding job moderating the conversation. So we look forward to seeing you in future webinars.
Thank you.
Thank you all.
Goodbye.
Goodbye.
Bye-bye.
Bye-bye.
Bye. Goodbye.